services, HIV counseling and testing, and many other vital health needs throughout Western Mass.
Woo!
Wow, it's great to see everybody. These abortion bans are unconstitutional. They violate our human rights to autonomy over our own bodies, and they're a social justice issue disproportionately affecting low-income individuals and communities of color. I think it's critical that we recognize what this fight is really about, and we have to go beyond the headlines to do that. This is not about caring for children. The states pushing these bans have the highest rates of infant mortality in the country. This is not just about abortion. The best tool we have for reducing the rate of abortion is contraception. But the same groups behind these bans are also pushing more and more regulation to prevent people from getting contraception. The hypocrisy here is obvious. This is a fight about sex, about stigma, and emboldening politicians to tell us what we can and cannot do with our bodies.
Woo!
We have to fight for Roe, and we must also not lose sight of the multitude of other threats to sexual and reproductive health care that are happening. While the Alabama, Georgia, and Missouri bans get all the headlines, equally dangerous efforts are underway, and many of them are under the radar. We have to work hard and educate ourselves and be vigilant to all of these threats. Threats to our bodily autonomy, to our human right to health care, and our right to be who we are, to love each other and live our lives in the way that makes sense to us.
Woo!
How do we fight back? Indivisible tells us we should be using our local leverage, our state representatives, our attorney general, and our members of Congress. We are very fortunate in Western Mass with the enlightened leadership that we have at every level. We have to work with our delegations to protect our communities and to preserve our rights and the rights across the country. I can think of 4 things that we can do and that we really must do. First, protect abortion rights in Massachusetts in case Roe is overturned.
Woo!
Other people will be addressing this, but we need to let our legislators know what we think about the Roe Act, a bill currently in our legislature that will solidify the right to abortion in Massachusetts, regardless of what happens in Washington. Second, we need to save Title X. Title X is the federal program that funds sexual and reproductive health care for low-income individuals at places like Tapestry. Title X funds the work in our Northampton clinic and throughout Western Mass. This year, the federal government proposed a gag rule that would defund places like Tapestry that get Title X money if we even discuss abortion as an option if you're pregnant. And they're directing funds to fake clinics whose only methods of family planning are abstinence or the rhythm method. With Title X under assault, we must use our local leverage, and we have been doing so. Tapestry joined Attorney General Maura Healey's lawsuit with 19 other states to block the gag rule, and we successfully got an injunction, at least temporarily.
Woo!
And we use our local power, our legislature, with great leadership from Western Mass delegation, who has promised to replace Title X funds if the gag rule does go into effect, so that Massachusetts residents are assured of medically sound and high-quality care.
Woo!
We feel good about this progress, but this fight is not over. We have to continue to work with our members of Congress to keep the government from coming between clinicians and their patients and from destroying Title X. Third, we need to let our members of Congress know how we feel about the so-called conscience rules. These are rules that would allow any clinician to deny care to a patient if they have if the clinician has any kind of moral or religious objections. This is not just about abortion. It includes care like transitional hormone therapy and could affect anyone whose health needs are stigmatized. Just imagine what it's like to go to your clinician, your doctor, and not know whether your doctor is going to be willing to provide you with the care that you desperately need. This rule is going to destroy the trust between patients and physicians and will lead to increased inequity in care. We have to fight back and give our members of Congress the stories they need to prevent these rules from ever taking effect. Finally, we must advocate against the destruction of Medicaid. Access to health care is a social justice issue, and Medicaid is a lifesaver. There are many, many efforts across the country to limit eligibility. And if they succeed, they'll undo progress not only in sexual health, but in HIV, treatment of opioid use disorder, and many other conditions. So to protect healthcare access and address inequities, we must support our members of Congress in their efforts to preserve this critical program.
Woo!
So we have our work cut out for us. Assaults on abortion, contraception, and Medicaid are assaults on our constitutional and human rights. We have to work together on these many fronts to protect the right to health care for everyone, to reduce health inequities in the name of social justice, and to maintain control over our own bodies and lives by protecting Roe. The fact that we're here together gives me the hope that we will succeed. We must succeed. Thank you.
Woo!